so that we can put it on our website, and students who weren't unable to attend today will be able to view it at a later time. And now it's my pleasure to introduce our host for the panel, Ms. Darla Frack, class of 1994 at NCC, who is a nurse. And she is going to be introducing the panel and getting us started on hearing the educational and professional journeys of our panelists this evening. Darla?
Thank you, Karen. It's my pleasure to be here on the panel and to be the chair of the alumni board at Northampton Community College, where I got my start in nursing. So this is exciting for me to be here. So let me introduce our panel tonight. Mike Ryan, a nurse manager at St. Luke's Anderson campus, is joining our panel tonight. And you'll hear a little bit more about them after I introduce all of them. We have Carl Hartner. He's a graduate from Northampton Community College, and he's an RN, and he works at Sacred Heart and also Bayada Nursing. Megan Kasak, graduate from LPN and RN program at Northampton, and she works at Lehigh Valley Health Network as an ED nurse. And we're going to hear from Katherine Kumi-Atiemo, Northampton grad, who works at Lehigh Valley Health Network as an RN in the orthopedic unit. And we also have Leanne Vigilanti, a nursing recruiter from St. Luke's University Health Network, joining us. So I'm going to start with a little introduction about myself. Well, Karen already told you I graduated in 1994. She asked me if she could share that, and I said, of course she could, because I look young anyway. So my career started actually at Sacred Heart Hospital in Allentown. I was a unit clerk for 7 years. So those of you who work in healthcare probably know what unit clerks are. And when I worked at Sacred Heart as a unit clerk, I really realized that I wanted to be a nurse. So that's when I decided to become a nurse. I saw what the nurses did there, and that's how I decided to go to nursing school. And the one great advantage I had was they had a really robust tuition program, and I was able to get my tuition paid at Northampton Community College. Great education, affordable. So that's how I got my start. I started, when I became an RN, I started as a med-surg nurse, and I floated throughout Sacred Heart to make money and get a lot of hours. And I worked in the short procedure unit area as well, in the one-day surgery area and GI area at Sacred Heart. And very quickly realized that I liked variety. So I took some other per diem jobs, worked at Easton Hospital as a float nurse. And one thing I'll say about nursing is there's lots of opportunities, and we could, that might be a panel question later, but I found there were very many opportunities in nursing, and took advantage of that by becoming a CPR instructor and ultimately a nurse educator in the hospital setting. And worked in Lehigh Valley my whole career at multiple institutions. I left Sacred Heart, worked at Easton, worked at many of the places that are actually part of St. Luke's now, Nathan Hunt and Palmerton, and a surgery center. And again, getting a wide variety of experience in multiple roles that actually ultimately led to me. I'm the vice president at St. Luke's Anderson campus now. And many of those experiences, all of them, helped me grow into the role that I'm currently in. So lots of opportunities. I worked as a nurse manager 6 years prior to being a vice president, and really realized leadership was where I wanted to be at. It's exciting. It changes all the time. I love a lot of aspects about it. Really I love nursing, and I would do it all over again. A little bit about my education, then I'll move on to the next person. Give them time. I have my master's in nursing administration from Cedar Crest College, where I actually also obtained my bachelor's degree. They had a good program there that accepted all my credits from Northampton, and that's it about me, a little bit about me. And I'm going to go in the order of introduction. So I'm going to ask Mike Ryan to introduce himself. He was, again, from St. Luke's Anderson campus, and he's a hospital supervisor and manager there.
Hi, everybody. Thank you for having me. Um, so, just a little background on me. I have been with St. Luke's for 14 years. I started as a PCA in Bethlehem on what was the cardiac unit at that time. They've moved around a bit. And I did that per diem as I was going to school. I went to University of Pittsburgh, so I was working in my breaks, coming home for weekends, working a little bit and going back, trying to get that experience and kind of see how the hospital life worked while I was going to school. So after I graduated, I stayed with St. Luke's. I moved to a different unit, see how things are a little bit different there. Now I moved to a surgical oncology unit. Not what I originally wanted. I kind of wanted to stay with cardiac. But the opportunity oncology, and like I said, I wanted to see kind of a little bit different world in nursing. And I got there and it turned out to be what fit for me. It was a little bit of kismet. So I stayed at Bethlehem for, a few years, working evening shift, working day shift, becoming charge nurse there. Anderson opened and I didn't come over right away, but I came over, I think, a year or so into it while they were working on growing their oncology floor. Came over to kind of help that program, help train the new nurses as that unit was growing. Eventually, I became the clinical coordinator, which is, for those of you that don't know, is kind of the head nurse on day shift, a little bit more responsibility, kind of growing into management and seeing that bigger picture. After a year or so of that, like Darla said, I became manager of the hospital supervisors, and I've been in that role for 3 years now. And working directly under Darla, so I'm going to be on my best behavior. And kind of seeing how the hospital functions a little bit more behind the scenes and growing and figuring out exactly where I want to move and growing into like management and seeing those behind the scenes. I think that's really it.
Well, thank you, Mike.
Yeah, my pleasure.
All right. And we'll have Carl Hartner. He's from Sacred Heart and works at Bayada Nursing as well. Oh, Carl? Is he on?
Can you hear me now? Yeah,
Yes.
Can you hear me?
Yes.
Can you see me?
Yes.
Can you see me? Okay. All right. Hi, everybody. Let's see. Well, I originally didn't go to school for nursing. I actually did electronics in the Air Force. And then when I got out, years later, I actually wanted to at least finish my degree in that. So I actually graduated from NAC in 2009 with that degree. But I was already working as a CNA at Graysdale at the time, and I kind of figured I wanted to do nursing. So I took electives for that would be prereqs for nursing. So then when I went and I got accepted into the program, I had pretty much everything done except for AMP 1 and 2, microbiology, and I think developmental psych, which I took online. So I got my acceptance letter actually halfway through the semester that I was taking my last prereq, which was microbiology. And so then I started nursing. Graduated from nursing at the end of 2014. And then from there, once I got my nursing license, I actually left Graysdale and started to work at Sacred Heart as a behavioral health psych nurse on the extended acute care unit, where I was there for the past, I'd say 5 years until just recently switching to per diem with St. Luke's Sacred Heart campus because St. Luke's bought us. And now I also work for Beata Home Health Care as a home health nurse. So two different aspects. They both have their pros and cons. I thoroughly enjoy being able to do both. And it's funny because I never would have thought to be a nurse. My wife was working as a CNA, and I had gotten laid off, and my wife was like, come to Greystone, give it a try. And I was like, I don't know about the whole like cleaning people and feeding them, but I ended up loving it, and it didn't even faze me. And I knew I wanted to become a nurse because I wanted to be able to be more involved in their care planning and just more involved and have more of a say and advocate for my patients. And I'll tell you, as a mental health nurse especially, we are their voice because a lot of them aren't taken seriously. There's still a negative stigma, so there's a lot of good that can be done. But I would say you definitely have to have a heart in it. So yeah, that's about where I'm at now with things. I also have special needs kids, and that kind of played into everything too. And I want to say that NAC was very understanding with that and really does work with you. They have a top-notch degree program. And yeah, I guess where I'll leave things.
Okay, thank you, Carl.
You're welcome.
Megan Kasak is next, and she was an LPN and now she's an RN, and she works at Lehigh Valley Health Network as an ED nurse.
Hi.
Hi.
My name is Megan. My little bit of background for me is, can everybody see me?
Yes, we can see you.
I was making sure. So I actually started at Pocono Medical Center in 2007. It's now Lehigh Valley Pocono. I started there as a tray aide in the cafeteria. I got my degree in psychology online and worked as a mental health tech on their behavioral health unit. I loved the nurses there. They were amazing, just watching them take care of, mentally challenged individuals and just having to deal with, just the challenges of a nurse and taking care of patients. So I chose to go back to Northampton Community College for nursing. I got accepted into the LPN program. And I was an LPN for 7 years in the Lehigh Valley Express Care. And then in 2018, I went back to school for my RN with 3 small children. My kids were 1, 2, and 3 at the time. So that was fun. And then I graduated in January. I started in Cedar Crest ER in February, but unfortunately due to low volumes in the ER due to COVID, they have temporarily displaced me to their transitional open heart unit, which I will be there until January 2021, hopefully. This is the second time they've pushed us back from returning. I also work as a flex mental health charge nurse at Kids Peace Hospital. And then I also very rarely work with infectious disease for general health resources. I go around to different nursing homes and assess their preparedness for COVID if it were to happen again, or how it would affect them. So I, assess, what plans they have in place, separating their clients, things like that. It is a very rewarding career. I do get to do a lot of different things, which is amazing. And I enjoy every day.
Thank you.
Thank you.
Okay, and we have Katherine Kumi-Atiemo next, and she's from Lehigh Valley Health Network, as a reminder, orthopedic.
Yeah. Hi, my name is Katherine Kumi-Atiemo. I am from Ghana, West Africa. I came into America 2013, and then I was doing home health. But I realized I wanted to be a nurse when I see the visiting nurse how they attend to the patients. And so I had to go in, start from the scratch. I went to Northampton 2014 to get my GED. And so when I got the GED, I went to Northampton again. I wanted to do LPN program. But something happened when I went to take the placement test. I met an advisor. And after taking the test for the LPN, I think I had 85. And he told me, no, don't do the LPN, do the ADN. But it will take you a long time, but I know you can do it. So go back, go and study and come back and write the placement test again. I know you can do it. And I was like, no, I can't do it. I have 4 kids. I can't do it. He said, no, you can do it. Go and take it. So he made me go back, and I came to study, and I went back to write the placement test, and I was able to get admission into Northampton. So that's how I began I did my prerequisite to the Northampton just before I was done with
Catherine, you froze.
Uh-oh.
Well, we could go back if she gets back on.
Sure.
Why don't we move on to Leanne Vigilanti? She's a nursing recruiter at St. Luke's University Health Network.
Thank you,
in
Darla.
January, just this year. And now I'm in a.
Do you want me to continue?
Yes.
Okay.
Here we go. Catherine, I'm sorry, you had frozen there.
Oh, okay.
Is there anything else you wanted to tell us?
No, I think I was I'm almost done. I was just saying I graduated in January, and I'm now in a Lehigh Valley Coconut on the ortho unit.
Thank you. Okay, Leanne.
Okay. Can you hear me?
Yeah. And
So some of the other speakers had started out by saying that they had worked, Darla as a unit clerk, someone else as a PCA. I did not have any healthcare experience. Always wanted to always wanted to go to nursing school. Life kind of got in the way, and I got married and started working. So I kind of abandoned that for a while. And then when I was pregnant with my first child, I was in a very, very bad accident. I was 30 weeks pregnant. I ended up being in the ICU for 2 weeks. I had major injuries. I had a broken femur. I had my spleen removed. I had pancreas damage. I had collapsed lungs. So I was in the hospital for 2 weeks. My son was born the next day with an emergency C-section. And he was taken to a different hospital because where I was, they didn't have a NICU. And the experience that I had with that, which was obviously very traumatic to me, was also life-changing. I went back to my job after about 6 months because I was in rehab and I had a small child at home that had some issues because he was premature. And I went back to work and I said, this isn't what I want to do anymore. I'm going to go to nursing school. So it took me a little while to get to my route where I wanted to be, but I'm sure there's many of you sitting in the audience that are working in a career right now that doesn't really feel like it's where you need to be. So in recruitment, I've heard from many, many people, and a lot of times it's an event like what I went through that really gets you motivated to kind of go after what you wanted to do and maybe walked away from previously in your life. So I, decided that's what I was going to do. I had a small child at home and my husband was 100% behind me. So it was really having a life event change that led me to go into nursing school. I was working prior to that, at the time I was working in a collection agency in human resources. So I've kind of gone full circle. I went to nursing school. I worked for a couple of years in the hospital. I started out on a cardiac unit. To be quite honest with you, I didn't really like that type of nursing. I wanted to do mother baby, but back in the day, they didn't take you into mother baby. I did my year there and then I worked in mother baby for a number of years. And then an opening came open for a nurse recruiter in human resources. And I thought, I have an HR background. That's a wonderful opportunity. So I really have a great role because I I kind of went full circle. Like I said, I worked in HR, wanted to go to nursing school, be a nurse. I've done that. And now I'm back in an office environment, but I work very closely with a lot of the students, go out and talk to them when they're in their nursing program about opportunities that we have at St. Luke's. So I have a great job. Nursing has given me a lot of opportunities, not just bedside nursing, which I think everybody needs to do for a couple of years, but there's a lot of opportunities out there for nurses in general.
Great. Thanks, Leanne.
Thank you.
Thanks for everyone for sharing your story. I don't think Erin's on, right, Karen?
I don't think so.
Okay.
I don't think so. So we don't have any questions in the chat. Does anybody have any questions that they'd just like to unmute themselves and ask any or all of our panelists? Terry, go ahead.
Hello, good evening, everyone. It's my first time at NCC. I'm from Florida. I was a paralegal there. I recently moved to Pennsylvania about 2 years ago. I've decided that now I've raised my daughter and she's older now. Now it's my chance to go back to school and pursue my dream of always being a nurse. My mother inspired me. So here I am, my first year. Because my background is, it's strong in law, what would the nurses that we have here recommend as far as looking and starting to build a new career in the health field with no prior experience? The only experience I really have is volunteering at my church in Florida with children. I did my high school community service hours in a daycare center. So and it's little to none, medical experience. So I just wanted to hear what entry-level positions could you find in a hospital setting or a clinic setting?
Leanne, do you want to take that question?
Yeah. Oh, could you tell I was excited to answer?
I know, I saw you there.
Terry, so that's a great question. And you were kind of like myself, going to nursing school and I didn't have any experience in that medical field. Did you say you were in your first year already?
This is fall semester is my first semester here.
Okay. So, I mean, I think the biggest piece of advice that I could give you, or Darla, or Carl, or Mike, would be to work in that field. There's tons of opportunities. Anderson campus has PCA positions, Bethlehem campus, whichever one's closer to your home or your school. And work, you could do a minimum of 16 hours a week and be eligible to receive tuition reimbursement at Northampton. So, and I think it's really great at that point that you're experiencing the hospital setting. And it really makes, I think, when you finally do get through and you finish with, and you're a GN and you're working, experience as a PCA really makes that transition even better, and it helps you. I remember when I graduated and I was working in the hospital, the girls that were PCAs, they were running circles around me. I was still trying to get the person out of bed and get them in their wheelchair, and not, like just simple things like that will really, really go a long way getting you prepared for when you do graduate. And it also gives you an opportunity to see other things. You get to go do your clinicals and you get experiences, but when you're working in the hospital and you're working maybe on a med-surg unit, you always have the opportunity, if they have an opening, to float to another unit. So you get a lot of different opportunities that will help you with your career.
Thanks, Leanne. You know what else? You're a paralegal, Terry, you said, right?
Yes.
So one of the things I think that's great about nursing is the wide array of opportunities that are out there that we all kind of highlighted. And I actually know some nurses who had some experience in the hospital setting, as a staff nurse, maybe in emergency department, med-surg, ICU, you name it. And they've actually gone on and been legal nurse consultants. So I think your paralegal background would be great benefit to that. And I actually personally know someone who does consulting. So I think there's a lot of opportunities out there for that as well.
Thank you.
Leanne, if someone wants to do PCA work,
Mhm.
but do you train them for that position then?
Absolutely. We bring folks in, regardless if they've experience or not. Really, the important thing with that role is that they, want to do that type of work. And they can very much make a difference in a person's life. As a PCA, you work very closely with an RN. And we do provide all the training at St. Luke's for somebody to come in that doesn't have that knowledge base yet. Nursing students are wonderful. We love to have them come on board. We know it's for a short time, but again, it's a good opportunity for them to, get that background and then for them, of course, to see how they like working at St. Luke's, and then we keep them as a nurse, hopefully.
Great, thank you.
You're welcome.
Does anyone else have a question that they'd like to ask? Don't be shy.
I have a question.
Okay, Carla.
Hi. My name is Carla. I work for a hospital now. I work for Capital Health in Trenton. I'm a medical coder and a clinical documentation improvement specialist.
Oh.
Fun. Yeah, it is fun. But I feel that nursing school would really help me improve my CDI credentials for sure. But how prepared did you guys feel after graduating for doing, for taking exams and doing bedside care? Do you feel like the program really helped you to feel like you could just jump into the workspace and be good? Or
Absolutely.
I mean, there's always stuff we need to learn.
Definitely. I think NCC prepares everybody very well for that.
Yeah.
I know recently integrated the ATI testing program as well, where you have to score a certain, you have to get a certain score to get that green light to take your NCLEX. So they really set you up to succeed. They don't want you to fail or anything. I mean, this is a big investment of time, money, everything. And I can just say that, especially with NCC, my personal experience of having special needs kids and having to make constant adjustments and everything, they really understand what it's like to be a parent, what it's like to be working full time, and they work with you. I mean, as long as you're doing what you're supposed to be doing and you're serious, they will help you. So I think I was, very well prepared. We have so many excellent professors at the college, and they are all with recent experience. They've worked the field, so it's applied knowledge. It's not just teaching out of a textbook. It's a lot of hands-on. I think it's very valuable, and you'll find it to be very rewarding. You'll be well prepared.
Can I add a little bit to that?
Sure.
I think the best part about the nursing program is that it is in class, but then you have your clinicals, which is hands-on.
Yes.
So you really get to everything. So it's almost like you don't realize how much you're learning until you're in that clinical setting and you're like, hey, I know what they're talking about, and I understand why they're doing this treatment, and I know what we have to do to get this patient better. So the nursing program is so amazingly designed because it's there for anybody who's book smart, who can understand things just by reading. But for me, like, I'm a visual hands-on learner. So being able to take what I heard and learned and read in the book and then go into clinicals and apply that really, really helped me succeed. And then at the end of the nursing program, we have our practicum. So where you actually go and work side by side with a nurse, no clinical instructor. You're there in the field that you want to work. If you're, I got to do my practicum in the ER at Cedar Crest, which is where I was hired to work. And it was amazing. It was almost like starting my career before I actually even started it. It's just, NCC really, really does an amazing job with their program.
Yeah, can I also add addition? The nursing lab also really helped I know Mary was there in our days. I don't know if she's still there, but the nursing lab is open to you. You have opportunity to schedule whenever you want to hands-on, like maybe there's something you don't feel confident in. You can just go to Mary and ask her anytime she's available. She'll give you the time. It's open for you to come and do hands-on practice. So it kind of build your confidence when you get into the hospital set. You know, I've tried this, I've done this practically, not from just the book, not just reading the book, but I have done hands-on practice. So it builds your confidence. And then we have the nurses resource lab that in the exams, you go for exams review, they are there to help you. There are resources available. It's just for you to make use of the resources and you will be good to go.
Can I ask a quick follow-up question? I'm so sorry.
No, don't apologize.
Did anybody do the part-time program? And how was that for you? Like the nights and weekends, I guess.
I did the weekend evening program
How was
back
that?
in '94. I worked full time. And I had to get in the evening weekend program because I worked Monday through Friday, and that was the only time I could go.
Same.
And here I am. I don't know if there's anyone more recent than that, but really, it's a great program for someone who has to work full time.
Okay.
It's not easy. I'm not going to sugarcoat it. It's not easy, but it's doable.
I feel like I've got a good background with CDI. I mean, I do know a lot of,
I would say you do.
Yeah, I'm good on that stuff. It's more the hands-on, actual, like I could tell you what's wrong with somebody by reading their x-ray, but I couldn't tell you how to put an IV in their arm.
So I think the examples we used earlier of having experience, other experiences like PCAs and unit clerks and hospital experience, you would come in and the hands-on would be more challenging, but you would have a lot of that book knowledge that it'd be a CDI. Because I'm familiar with the role. We actually have RNs that do the CDI role at our hospital.
Yeah, I have a CDIP from AHEMA, which is our medical, I have a background in medical records. I have a health information degree. So I did an associate's degree with anatomy and phys and all of that stuff. So, but nursing seemed like the next logical step for me. But I appreciate all your answers. Those were really great.
Great.
Thank you, Carla.
I think we have a couple of questions in the chat that that Imani's going to raise and possibly her own as well.
Yeah. All right, thank you. All right, so the two questions we have, one of them, can you guys hear me?
Yes.
Yeah.
Okay, good. Okay, so one of the questions were partially answered. Does NCC offer the LPN or RN program in the evenings? And this is from Marcia. Hopefully I'm saying that correct. I work full time and cannot afford to give up, so the evening classes would be ideal for me.
The RN program offers the nights and weekends.
Right. I'm not sure about the LPN program.
No.
I think we have Tim Brown here. Tim, are you able to talk about that?
Yeah, I can actually throw a link into the chat room for people to look at as well. The next one is offered in spring of 2022. They're on the evening, but I can throw in something for details about that as well.
I think one of the opportunities you might have if you're going to go into that program, you might need some general study classes that you could work on prior to getting into the nursing program as well. That's what I did. I worked on all of those and got those out of the way. And then I went in the nursing program and I only had the nursing credits to take.
I did the same with the generals first.
Yes.
And quite honestly, I was told that because there's so many applicants. I mean, I remember the welcome, where they sit you down in the auditorium and they tell you, welcome to nursing, you've been selected. And it was like 35 of us, I want to say, and they said they had over 1,000 applicants. So I know one of the first things they look for is, do you have all your generals done? Do you have all your prereqs done? And you have to have like top-notch grades to get in because it's so competitive. So yeah, just I would say keep that in mind when you're going through,
The nice thing about the LPN program, and I did NCC's LPN program before I did their RN program, is that it's a year long. So it's an August to August class. So if it course, the summers are a little hard because you are basically in class Monday through Friday. You have class for 2 days and then clinicals for 3 days. But that's why I chose to do it first. I wasn't really sure. I hadn't really been really in medical yet. I wasn't sure how I was going to feel about nursing. So I did their LPN program. And even better is that if you do the LPN program first, when you go, if you choose to go back for your RN, you get to do the accelerated program. So you actually go in and you start in their med surg class. You don't have to take nursing 101 again. And I do believe you can still test out of the maternity. So when I went back for my RN, I started in August in their med surg. I did continue with maternity just because it had been a while since I took that class, but I was offered the option to test out of it. So that is another really great thing if you do choose to do the LPN program over the RN. And then NCC, like I said, has the accelerated program if you decide to go back.
Imani, do you want to read the next
yeah.
question?
Yeah, one more question. This one is from Christy. So she's just trying to figure out which path would be best for her, the LPN or the RN. So could someone just explain the difference between the two?
I guess I can take that one too.
I could too, Megan, but since you actually were an LPN, I think you're great to answer that.
Yeah, I was an LPN for 7 years. So believe it or not, LPN, there really isn't a very large difference between what an LPN can do and the RN. Most people will say it's the pay, which is true. But LPNs, so like I worked in express care, I did home care. Actually, when I started my LPN career, I started working on a med-surg oncology unit at Pocono Medical Center. And then I transitioned from that into the express care. They don't really hire LPNs in hospitals anymore, but there are still a lot of opportunities. The biggest difference I would say is probably the amount of responsibility that an LPN has compared to an RN. We, as an RN, we're responsible for their initial assessments, whereas LPNs really just do focus and are always have to work underneath a charge nurse. Whereas we have a little bit of autonomy as an RN, we, work really side by side with doctors. Not that I didn't as an LPN, but it's just a little different. It's Northampton's LPN program, I'm going to say, is probably just as difficult as the RN program. It is just as demanding. You have to study very hard. But going through their LPN program, it really helped me pave my path for my RN. I studied very hard in my RN when I was in the RN program, but that background as an LPN, I mean, it really helped me, really, because the RN program, they focus more on critical, it's hard to explain. So the courses are the same up until your last semester, where in the LPN program, you do maternity and psych, and you do a GERI rotation. Whereas in the RN program, you do your nursing 101, med surg, psych, maternity, but then you do a critical care rotation. So that critical care is something that you don't really get as an LPN just because it's not really the setting. But, as an LPN, you still get to work with trachs. You get to work with, patients with PEG tubes. You can basically give medications through IV pulls. You just can't do IV pushes. When I graduated as an LPN, they had actually literally just added central line dressing changes to our scope of practice. So they had to throw that into our GERI rotation because it was something that they was now capable of doing as an LPN, which it is an ever-changing, growing practice. So I know when I went back to school for LPNs, there was talk that, LPNs are going to be phased out. It's only going to be RNs. But the truth is I have just as many emails for LPN positions probably right now as I do RN positions. So there is same opportunity, very different opportunities as an LPN. The nice thing about RN is that you do get as many opportunities, but you do get paid a little bit more.
Leanne, I'm wondering if you have anything to add to that from the St. Luke's perspective about LPNs and RNs and maybe what you're seeing as employment possibilities.
So some of the campuses do hire LPNs for specific areas. It's kind of limited though. I mean, we do hire LPNs, and Darla, if I'm missing something, just remind me. We'll hire LPNs at skilled nursing, some of the skilled nursing units. We'll hire LPNs in the behavioral health units over at Sacred Heart, Quakertown.
Yeah.
And also up at the Lehighton campus. We also hire LPNs in wound care, in the wound care office, and then LPNs through the physician practices. I think that's probably most of the areas that will hire an LPN. And then as far as opportunities in the hospital, they're basically RNs, you know, for med surg or for critical care, ER, things like that. So
yeah, that's because of those few things that Megan referenced earlier in regards to assessment of patients. And there's actually a couple things. There's a couple meds they can't do IV push. I think Megan said that they can't hang IV drips, like, which is, you know, and they can't hang blood or blood products or do chemotherapy. So there's some licensure things, and that's why acute care, they've really been phased out of hospitals for the most part, except for the things that Leanne talked about. But lots of opportunities, I agree with you.
All depends what you're looking for too.
Yes, exactly.
You know, if you know where you're trying to go, what area of nursing, that'll influence your decision whether to go RN or LPN. And then actually, I just want to add something on that. Also with the RN, we have, you know, NAC offers the associates, whereas like there's a lot of BSN programs. But if I can offer a little bit of insight into that, I chose to do the ASN before going further rather than going right for my BSN, because whether you're ASN, BSN, MSN, you take the same NCLEX and you take it once. So in some regards, it behooves you to take, to do the 2-year program, pass your boards, get into the field and everything, and at least, you know, kind of determine if that's what you truly want before you really invest a long-term education in it. You know, because I have known people that thought nursing was for them, but, you know, they either had trouble passing the NCLEX or they did the 2-year program, but then they said, well, you know, I don't want to be a nurse. I want to pursue something else. So you want to look at how much time and money, tuition, whatever you want to say that you want to invest into this. And I think NAC is a really good stepping stone for that. They're very affordable. I mean, I paid for my tuition out of pocket from semester to semester, and so did my wife. So I have 0 student debt. So I think for me, it was kind of the smart choice to just go right for the associates, get through the NCLEX, and then do the RN to BSN or RN to MSN program, which I'm planning to do sometime in the future.
Great, thanks, Carl. I think, Amani, there's a couple more questions.
Yeah, 2 questions. So they're both from Terry M. So he says he has taken cultural anthropology course instead of intro to sociology. So reading, for example, the St. Luke's School Nursing Prereq, one of the courses listed is having to take the intro to sociology and not the cultural anthropology. So should I take the intro to sociology to be able to get into the nursing program?
I'm going to answer yes, but I'm not sure about the prereqs at Northampton. Does anyone remember from that was closer to graduating?
The intro to sociology is going to be a sure bet. The SOCO 103, I believe, is going to be the sure bet. I can leave my email address though in the chat And if you'd like, I can check on that cultural anthropology for you to
I
see if
think-
that is something. I think as an elective, it's probably in that list, but I'd want to make sure.
Tim, I would also add, like, I took some anthropology classes in my BSN program. So that might be something if they're currently already in it and if they're interested in a BSN, you're going to see some of those classes that might contribute to your, credits.
Yeah.
Okay, and then the next question is from Terry as well. Because of the COVID-19, volunteer/job shadowing internship opportunities have been placed on hold, where can students go to seek these opportunities in the current times we are in?
Well, that's a great question. I don't know if Leanne wants to tag on. What I would say is, I think anyone on our panel, I don't want to speak for them, but I will anyway. I'd be willing to talk to anyone who has more questions after the panel's over. I've met with prospective students or current nursing students to talk at least about if you had more questions beyond the panel. I know that's not the same as shadowing, but at least it would give you an opportunity to, talk in more depth and answer more questions for you. Leanne, I don't know what else you would add.
Yeah, in the past, we do allow shadowing. There is a form that we have you fill out to make sure that you have, everything that you need through Employee Health. It gets reviewed through there. So there's a little bit of work that you have to do on your part. Unfortunately, with COVID, we aren't having folks come in to shadow. So, that probably isn't an option right now, but hopefully in the next couple of months, that'd be something that we'd be able to make accommodations and let people come in to shadow in various areas.
I think it depends on the department you're talking about too, as far as the risk involved with possible exposure.
Terry, this is Karen from the Career Services Department. We're working on a job shadowing program now, and I can get the information to you. I know that there's a good possibility of a nursing job shadow with one of the companies that our employer engagement person has been in touch with. So it's Fresenius, which is renal dialysis care. And I'm not sure, honestly, if it's an in-person or a virtual job shadow because we're trying to do different things. But I can shoot that information out to everybody who was on the call tonight so that you have it.
Yes, thank you. That would be greatly appreciated.
Okay.
All right, and the next question, I'm so sorry if I say your name incorrectly, Mahami, just asked, I just started working in healthcare fields as a CNA at Manor Care about 8 months. I'm now taking my prereqs, but I'm not sure if I should go for the LPN or the RN. What is your suggestion between LPN and RN?
It all kind of depends on what you want to do. If you want to continue working at Manor Care, I work for General Health Resources, so sometimes I go and cover for the nurses there to pass meds. I did that as an LPN, and I do it sometimes as an RN. As far as for long-term care facilities, the biggest difference between LPN and RN is LPN is more on the floor, you're passing meds, doing wean treatments, whereas like the RN is usually the house supervisor. So they help with the admissions because they need to do the initial assessment. They help coordinate care if they need to be transferred to the hospital. Which I'm sure you see all those things working at Manor Care. If that is not really somewhere where you want to go and you want to do something more acute care, where you do have more critical patients, I would suggest going for the RN. Like I said, the LPN program is just as difficult as the RN program. I think I didn't have children when I did the LPN program, so I can assure you that I probably put in just as much time and effort as I did in the LPN program if not more, than I did in the RN program. With that being said, I actually still graduated with honors in the RN program. So I did put in just as much work, but having that LPN background really, really helped me. Really, the biggest difference is when you get into that critical care aspect, and just your assessments and stuff like that. We still, in the LPN program, you still learn how to do a head-to-toe assessment. You still learn about all the meds, why you're giving them, why they need them. As far as the education goes, I'm going to say it's very similar up until it gets to that critical care aspect. So the biggest difference is really going to have to be where you want to work. I'm going to say as an RN, you definitely have a lot of opportunities, probably a little bit more than an LPN. But you do have a lot of options for LPN too. You can do home care, you can work in express cares, you can work in family practices. So if you want like a Monday through Friday job, you can work in a family practice office or oncology or vascular. There's definitely, it depends on really what you want to do as far as, but if you're looking for like which one would be easier, neither one is easy. They both require a lot of work, a lot of time. There's a lot of work-life school balance that comes into play. I know just for myself, it was definitely hard. I worked full time as an LPN, and I had 3 small kids when I went back to the RN program. There was a lot of late nights, not a lot of sleep, but there is a light at the end of that tunnel, and Northampton really prepares you for when you get out of nursing school. You don't feel it, but once you start in your role, you just realize like, wow, you're really prepared, and you're never going to learn everything. It's still like nursing is a constant education. So even today, it's like I go to work and I'm probably going to learn something new. But that's the nice thing about nursing, is that it's never boring because there's something new around the corner every day.
All right, and Haley has asked, she has a question building on the RN to BSN topic. Not sure what that entails then. Haley, are you there?
Yeah, I didn't know how to type it out, so I figured I'd just ask it in person.
Got it.
So I'm a high school senior at Bangor High School, and I plan to go for my associates. But I did the Career Linking Academy last year with the St. Luke's, and they talked about how like the bachelor's degree is going to be more like wanted than just your associates. And I was just wondering if like that's a thing, and if sooner like they won't even like it'll be more bachelor's oriented rather than just your associates. So I didn't know if it was better to just go like straight through now, since I won't be able to start my career for like another year or so since I'm still in high school. But I was just wondering what your guys' opinion would be on that.
So you're asking if you wanted to get hired at St. Luke's, do we hire bachelors over associates?
Yeah.
Okay. Well, that's an easy question for us because we do have our own program for nursing students, but not to talk about that tonight. Your associates, you come out prepared. We hire a ton of Northampton Community College students. And our nursing program is a diploma program. So our own school is not a bachelor's prepared school. So, we hire associates, we hire diploma. Yes, we do hire bachelor's prepared nurses, but for the most part, our school in Northampton really our major, we have a lot from those programs. We do encourage people to continue their education. We think it's important. You never stop learning in nursing. But one of the nice things, if you go to the associates program at Northampton, you can get finished in 2 years. You can start working. If you work at St. Luke's, you would get money towards getting your bachelor's degree. If you're full-time, you get $8,000 a year to go towards your bachelor's. So that would be a practical way to do it. And the bottom line is we do hire associates. Okay.
Okay. Thank you.
You're welcome.
I started with my associates and working on the floor. Like I came back from Pitt with my associates from being out there, and I mean you start with like in the hospital, whether you have a BSN or associates or even just through the St. Luke's school the
Diploma.
the diploma. Thank you. You're all kind of on even footing, and how well like working in the hospital goes, it's pretty comparable. One of the things that I stopped for like to get my associates and come back was I knew St. Luke's had like great tuition reimbursement, and you're gaining that valuable experience as you're still going through school. So I know a lot of people that start with associates and move up and just find those other opportunities, which you need experience for. So going through school and you're getting experience, when you're ready to move on to your next opportunity, you're kind of a little bit ahead of some other people.
This next question is from Crystal. Does taking the LPN as a step into the RN program help the possibility to getting accepted to the program?
So I don't know if it plays a role in getting you accepted faster. I know that one of the things they really do look at is your grade. So I was fortunate enough to do very well in the LPN program as well as my prerequisites. And then I scored pretty well in the T's. And so I think that might have, I've had friends who were LPNs who did not get into the RN program the first time they applied. That is mostly because when you go into the accelerated program, there's not a spot there for you. The way an LPN gets accepted into the RN accelerated program is essentially if somebody did not pass nursing 101 or dropped out in that first semester, and that is how the the LPN during the accelerated program gets a chair. So like if everybody does well and everybody passes, there is a good chance that you wouldn't get accepted into the accelerated program. But that was not like the case. I applied and then I got accepted right away.
Thank you.
Okay, and this is another question from Christy. Our end goal is to eventually become a lactation consultant working in the maternity ward. So in your opinion, which path do you feel would be the best path for her, RN or LPN program?
She wants to be a lactation consultant, then she would need to work in the OB arena, and she would get a position. We actually have an internship that we hire RNs into. She wouldn't get into working into a mother baby unit as an LPN at St. Luke's. So she should definitely go the RN route.
Any last
That was
questions?
the last question. That was the last question in the group chat.
Thank you, Monty.
Yeah, of course.
Anybody else have a last burning question they want to ask? All right. Well, I'm just going to ask our panelists before we say goodnight to each other. Do any of you have any final words of advice for our students and potential students? You know, like 10 words or less.
My advice would be I love nursing.
Yeah.
I agree with that.
Great
Yep.
opportunities.
It's a heart thing. You have to have your heart in it.
Mm-hmm.
It's not just a job. It's if you're pursuing nursing for the money, don't bother. There's other things you can do. It's very important that you are vested in this and you have the heart to and the patience to deal with everything that comes with it, because it's challenging. It is, but it's very rewarding.
And I also think NCC make available a lot of resources. So make use of the resources. Take the opportunity that NCC brings your way. The NCC is there to support you all the way through. So make use of it.
I agree. Well said.
If you can get through NCC's nursing program, you can do anything.
Oh,
Yeah.
I know.
Yeah.
You're on the billboard now.
If I had done that before going in the military, I think boot camp and everything would have been easier. I was more stressed going through the nursing program than I was going through basic training for the force.
Yeah,
I believe that.
but it's the most rewarding stress you'll ever
It
go
is.
through.
Yeah, it is.
Yes, it is.
Well, I want to thank everyone, our panelists, our participants. There were faculty and staff on board, and earlier on in the session, Dr. Carolyn Bortz, who is our Vice President for Academic Affairs, was on the session with us, and her background is nursing, and look where she is now. I am going to be sending a survey out to all of you, panelists included. This was our very first Zoom allied health career panel, and of course we want to keep improving, so be honest, because we can always do better and we can always learn. So thank you so much, everyone. And as I said at the beginning, I was recording this, so it'll show up on the Center for Career Development webpage at some point in the future, if you want to refer back to it. And of course, you can always reach out to any of us, to myself, to Jeremy. And if it's okay with the panelists, with the survey, will share your email contact information.
Absolutely.
Absolutely.
Yep.
Thank you very much, everyone. Have a great evening.
Thank you.
Thank you for having us.
Take care.